Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Consultant Neurologist. Today I am going to discuss about what is the optimal dose of aspirin in patients with diabetes and without diabetes for secondary prevention of cardiovascular diseases. The article came in diabetes. So this is the comparative effectiveness of aspirin dosing in cardiovascular disease and diabetes mellitus. Subgroup analysis of adaptable trial. Published in Diabetes Care, September 15, 2023. Let us look into the background. Aspirin is used for secondary prevention of cardiovascular events. The optimal aspirin dose is it 81 mg or 325 mg remains debated, especially in patients with diabetes. So this trial is aimed to compare aspirin dosing effectiveness and its safety. So that is the background of the study. So objective of the study is to evaluate the effectiveness of 81 mg versus 325 mg in preventing cardiovascular events in patients with cardiovascular disease and analyze the outcome, especially in patients with diabetes mellitus. So let us look into the type of study. This is a randomized open label pragmatic trial. There were 15,000 adults with cardiovascular disease. The interventions were random assignment to 81 mg or 325 mg of aspirin daily. They were followed up for a median of 24 months. The endpoints were mortality, all-cause mortality, myocardial infarction, stroke, or major bleeding. These were the major endpoints. So the details of the patients are given in the stroke diagram. So the total number in 2.7%, that is for the history of diabetes was missing, so they were excluded. 8,986 patients, that is 61% were having no diabetes, 39 were having diabetes. Depending on the hemoglobin A1C, among the diabetes, 77% were controlled, that is hemoglobin A1C less than 8%, and 22% hemoglobin A1C was greater than 8%. So that is the details of the patient. So let us look into the results. The primary endpoint was similar rates of cardiovascular events in both groups. Regarding safety, slightly higher major bleeding in 325 group. It was compared in diabetic subgroup. It was consistent outcomes with the overall findings. So there was not much difference in patients with diabetes, without diabetes, and who were having cardiovascular disease. Higher rate of dose shifting from 325 to 81 was seen in the 325 group also. So in summary, I can say that there were not much difference between the two groups. So this is the hazard ratio. On this side is favoring 325 dose, and this side is favoring 81 mg dose. So let us look into the interpretation. 81 milligrams of aspirin is as effective as 325 mg for secondary prevention, including those with diabetes mellitus. Lower bleeding risk favored 81 milligrams, and so this supports low dose aspirin as the standard of treatment. So 81 milligram, that is a low dose aspirin, can be considered as a standard treatment. So what are the strengths and limitations? It was the large sample size and high-risk patients with that is diabetic patients were included. Limitation, high rate of dose switching, open label design may lead on to bias. So this is the summary of the result. The study suggests that higher dose of aspirin does not yield added clinical benefit, even in more vulnerable patient population with diabetes and atherosclerotic cardiovascular disease. So that is the take-home message. So in conclusion, we can say in cardiovascular disease and diabetes, 81 milligram of aspirin is comparable to 325 milligrams of aspirin for cardiovascular protection. Lower dose may be preferable due to similar efficacy but better safety. So that is the take-home message. So start with 81 milligram of aspirin for secondary prevention in diabetes with cardiovascular disease. Regularly reassess the risk benefit, especially patients with the bleeding risk. So this is the take-home message. You can start on low dose aspirin instead of high dose aspirin. Hope this was useful to you. Stay tuned.